So Barry, what do we know about this consignment?
Well, Shahan, what we know about the consignment, and this is related to the information that has been passed on to me, specifically I've had sight of certain documentation. What it shows that on the 7th and the 12th of last month, there were these two consignments of 2.6 tons each of the malaria drug chloroquine that were imported from India via Dubai and arriving in Johannesburg. What I've managed to establish is that the company that imported these particular drugs, or the company listed as the importer on the documentation that I've had sight of, is not listed or licensed by the South African Health Products Regulatory Authority and permitted to import these particular drugs. So the investigation has been started to find out on what authority and how exactly they got in. The health department telling me that it does appear, and the words that the health department has used, they slipped through port health authorities, and the investigation has now gone on further to involve the SAPS. But the question remains, how did it get into the country in the first place?
Yeah, and the other question, Barry, is exactly who is being investigated here?
Well, the authorities that are looking into this is the Old Medicines Control Council, now SAPRA as they are referred to. They're investigating this, but they have also involved the SAPS, explaining to me that they've had a look at their records. This particular company that is called Balmoral Norse, it's a company registered to operate in the aviation sector, but here it is importing, according to the documentation, pharmaceuticals. So the investigation will involve the SAPRA as well as the SAPS, but now Port Health as well, to try and establish this. But I spoke to Mngisi Wondo from SAPRA, and he had this to say.
That's why I'm saying it's not easy for SAPRA now to say these people did wrong, we are arresting them, until we know exactly what happened. Hence I said, yes, what you're saying is true. Internally, we did our investigation. We couldn't see the company on the register of products, of companies that are licensed by SAPRA. And then we checked on Section 21, we couldn't pick that up as well. So hence now the next route will be, then it may be outside our jurisdiction, let's involve SAPS then to further look at the matter.
So chloroquine has gained some prominence since US President Donald Trump touted it as a cure in March. What exactly is the concern about the drug being imported?
Well, you must imagine that the regulatory authority is not just about the company and the standards required for the company that's going to be importing the drug, but it goes as far as ensuring that where it is manufactured, that all the required standards are followed. Now, I was speaking to SAPRA, and they were explaining to me that where a particular company applies for a license to import a particular drug, they would have to list and provide the details about the company that manufactures this drug. In this case, the company is called Indian Pharma Enterprises. Well, SAPRA has no record of this particular company. What ordinarily would have happened is that our regulatory authority would liaise with their counterparts in India, and there would be a proper check of the facilities in that particular country as well. This has not happened, so it relates to the standards and what kind of drugs might make it onto the market. Wondo had to say about this particular aspect.
It's a huge worry, especially for the safety of the patients, as you've mentioned. That's why there is SAPRA to regulate medicines, so that the medicines are safe and also efficacious and of good quality, so that we have that consistency with the medicines on the market. And we also have post-marketing surveillance systems like pharmacovigilance unit that monitors side effects and your ATRs that are reported by patients. So in this case, what may happen if this went into distribution, you'll get now more people reporting adverse drug reactions, and then we were going to pick up very late that no, there's a drug people are taking, because then when you report the adverse drug event to your doctor or to a hospital, they will be having that information of the product and all of that. So it may be late to chase the product if it's full in the market. However, part of this, I'm happy you're raising that question, part of this investigation will be to know if this product is distributed in South Africa. If it was distributed in South Africa, then SAPRA will go into a recall to go and remove the product from the market.
All right, we'll continue this live broadcast from my home in Johannesburg in a moment.